Okay, thank you so much for making time to come this morning. I was advised always start something with a story, so I said, okay lah, I must find a story. So I'll tell you one that is probably more relevant to you. I've got many stories, I guess. And the story goes like this. So like Keith said, I started my career as a child protection officer. You do home visits. One of the significant home visits was one to, I don't know whether today you're familiar with this term, called Mama-san. So I visited because I need to sort of speak to a young girl. And at the end of the home visit, towards the end, she said this to me. And she was very curious. She said, and all this was in Cantonese in those days. And she said, how much do you earn? So I told her my salary. Those days is quite different from yours today. Then after that, before we depart, she said this to me. And she looked at me. And she said it in Cantonese so that it's got that flavor. And she said, 有咩事你可以嚟可以 what's the word find in Cantonese? 可以 basically you can come and look for Mama-san. You know, and the implication of that was that our salary was here, the Mama-san was probably here. So that's an interesting story. Today, you don't have to worry about that. All right, I think we publish the entry level for social workers every year. Right, so you're guaranteed that. So you don't need to worry too much about that. All right, so I thought that is an assurance for you how far we have come, all right, in terms of salary. All right, I want to spend this morning perhaps to give you really an overview about the protection work that we are called to do, which is really an amazing piece of work. Demanding though it may be, but I think it's such a wonderful piece of work, and I hope to be able to describe that to you this morning. So it's really my privilege and responsibility to stand before professionals. I've seen professionals here and also at the back, and to give credit also to Kitai, you know, one of the stalwarts where I have the privilege of working alongside with. Okay, and professionals who really carry one of the heaviest mandates in social service, the protection of vulnerable children and adults. Protection work calls for moral clarity, emotional stamina, sound judgment, and above all, an unwavering commitment to humanity, even in the most complex and painful situations. Today, I would like us to visit first principles to reaffirm, iterate, and strengthen the fundamentals of child and adult protection work in Singapore, and to remind all of us to hold firmly to the delicate balance between care and protection, care and control, between service and safeguarding, between accountability and rehabilitation. Protection is a societal covenant. Protection is a societal covenant. It is not merely professional function. When the state intervenes in family life, when we investigate abuse, when we remove a child from harm, when we restrict an adult perpetrator's access to a vulnerable person, we exercise authority on behalf of society. That authority must always be justified, grounded in evidence and risk assessment, proportionate, calibrated to the level of harm, accountable, open to scrutiny and review, humane, mindful of dignity even in enforcement. Protection is therefore not only about rescuing victims. It is about upholding public trust that interventions are fair, necessary, and anchored in the best interests of both individuals and society. While principles and policies evolve and practice models are refined, the foundational principles of protection remain constant. So let's visit some of these principles. The principle of best interest of the child or the vulnerable person. And by vulnerable person, we must remember that we're not just talking about the elderly. All right, a lot of the provisions now cover persons with disabilities as well. For children, this is paramount. Every assessment, every placement decision, every reunification plan must answer one question. Does this serve the child's long-term safety, stability, and development. Short-term comfort cannot override long-term harm. Reflect on that. Short-term comfort, sometimes comfort of a practitioners, cannot override long-term harm. For vulnerable adults, the principle translates into safeguarding the well-being, autonomy, and dignity of the person, recognizing that protection must not become overprotection that strips the person of agency. Principle number 2, the safety, permanency, well-being framework. Protection is not a single act. It is a trajectory. It is a trajectory that includes safety, permanency, and well-being. Safety because it is about immediate risk mitigation, permanency because it is about stable caregiving arrangements, well-being because it is about developmental, emotional, and social recovery. If we stop to rescue without restoration, we leave protection incomplete. Principle 3, least intrusive intervention. State intervention must be decisive, but never excessive. Whenever safe and possible, we work to strengthen families, activate kinship networks, and build community buffers. Removal, institutionalization, and legal enforcement are sometimes necessary, but they are measures of last resort and should not be first instinct. Principle number 4, shared responsibility across systems. Protection is never the work of a single agency. It requires tight coordination across social service agencies. All of you are represented here. Healthcare, education, law enforcement, courts, community partners. Fragmentation creates risk. Integration creates safety. I'll not touch on the evolving risk landscape. Protection work today is more complex than ever. We are seeing poly-victimization across the cause, intersections of mental health, addiction, and violence, digital exploitation, and online grooming, caregiver stress compounded by economic strain, aging caregivers harming or neglecting dependent adults. Risk no longer presents in neat categories. It is layered, dynamic, and often hidden. This demands that practitioners like all of you and practitioners in the making, some of you are training to be as social work students, it demands that practitioners move beyond procedural compliance to analytical practice, the ability to read patterns and not just handle incidents. I'll now inspire you to think of yourself as a risk assessor and yet hope builder. Protection officers, social workers, psychologists, and allied professionals sit at a critical junction. You are both risk sentinels, identifying harm early, and recovery architects, designing pathways out of trauma. The dual role is emotionally taxing. You see the worst of human behavior, cruelty, neglect, exploitation, yet you must hold on to the belief in the possibility of change, and change for the better. Without that belief, protection work becomes enforcement alone, and enforcement without hope erodes the very ethos of social work. I'll now touch on the enduring tension, the balancing of care and protection. So what is the central tension in protection work? We are asked to be compassionate, yet firm, supportive, yet investigative, empathic, yet forensic. Too much emphasis on care and we risk minimizing harm. Too much emphasis on control and we risk dehumanizing those involved. Professional maturity lies in managing this tension, not eliminating it. We must be able to say, I care about your struggles, but I cannot allow harm to continue. Holding both truths simultaneously is the essence of protection work. Protection work is about accountable service, serving victims, and safeguarding society. Our first duty is to victims, to believe them, to hear them, to protect them. But protection also serves a wider societal function to signal that abuse, violence, and exploitation will not be tolerated. There are accountability mechanisms, investigations, court orders, mandated programs, and they serve the purpose, and they are not punitive alone. They are protective. Why? Because they create deterrence, public assurance, structured pathways for behavioral change. When accountability is absent, victims remain unsafe and perpetrators remain unchallenged. In protection work, we also uphold the principle of being humane in the rehabilitation of perpetrators. And here lies perhaps the most difficult challenge. Can we be humane towards those who have caused harm? The tension is perhaps felt more intensely by those who work directly with perpetrators. And PAY, for example, works quite a lot with perpetrators, and increasingly more of you work also with perpetrators. We must focus on perpetrators not because harm is excusable, but because rehabilitation is necessary for long-term safety. Most perpetrators are not one-dimensional villains. Many carry histories of trauma, learned violence, substance dependency, cognitive or mental health challenges. We need to understand context, but in doing so, it does not absolve responsibility. We need to understand context to inform our intervention. Effective perpetrator work includes behavioral accountability programs, psychological treatment, family violence intervention, substance abuse, misuse rehabilitation, parenting capacity rebuilding. If we fail to rehabilitate, we risk recycling harm across generations. Protection must therefore interrupt cycles, not just incidents. Now I'll touch on the ethical use of authority. Protection would carry statutory power, right? Counseling, social intervention, surveillance, removal, court action. With power comes ethical obligation. We must guard against bias in risk assessment, cultural misinterpretation, class-based assumptions, intervention fatigue leading to premature closure. Authority must always be exercised with evidence, documentation, supervision, reflective practice. Power without reflection can re-traumatize the very people we seek to protect. I'll now touch on the invisible backbone, which is about you, the practitioner's resilience. Let me pause to acknowledge the emotional toll of protection work. You hold stories that are heavy. Children harmed by those meant to protect them. Seniors neglected and suffering in silence. Persons with disabilities exploited. Vicarious trauma is real. Burnout is real. Moral distress is real. If we want accountable, humane protection systems, we must invest in practitioner well-being, clinical supervision, peer debriefing, workload calibration, trauma-informed organizational cultures. A depleted workforce cannot deliver safe protection. I'll now touch on the Singapore context because there are strengths that we can build on. Singapore's protection ecosystem has strengthened significantly over the years. Clearer legislative frameworks, mandatory reporting structures, multidisciplinary case conferencing, specialized investigation units, enhanced caregiver support programs. But systems are only as strong as practice on the ground. Policies do not protect people. Practitioners do. Your judgment calls, your persistence, your courage to escalate concerns, these are what keep victims safe. Protection work requires courage of several kinds. Courage to act, to intervene early, even when evidence is incomplete, but risk is high. Courage to confront, to hold perpetrators accountable without hostility or contempt. Courage to care, to remain compassionate without becoming compromised. Courage to reflect, to question our own biases and decisions. Professional courage is quiet but unseen, but it is the backbone of safeguarding work. I'll now challenge ourselves to hold that balance. All right, as you return to your agencies, your investigations, your case conferences, I invite you to hold three balances intentionally. Balance of care and protection, be warm but do not waver on safety. Balance accountability and rehabilitation, hold perpetrators responsible while creating pathways to change. Balance individual service and societal safeguarding, protect the person while upholding public trust in justice and safety. If we lean too far to one side, protection work loses integrity. If we hold the balance well, we hold and build a system that is firm, fair, and humane. Protection work is never easy. There will always be ambiguity, urgency, and moral weight. But remember this, every child made safe, every vulnerable adult shielded from harm, every family cycle interrupted. These are profound societal victories. You are not only managing cases, you are shaping futures. You are safeguarding dignity. You are building a safer Singapore. Thank you for your courage, your professionalism, and your unwavering commitment to those who depend on us most. Thank you.
Thank you so much, Ms. Ang. I think that was very inspirational and many things to take away, even if you're not a